Sit on a block or a cushion to help you tilt your pelvis forward. Bring the soles of the feet together, knees wide. Sit tall. A gentle squeeze on your shoulder blade and draw your chest forward towards the knees. Notice what you feel in the hip joint as you do this. Notice how near your chest is to your knees. Notice how your low back feels. Allow the chin to come into the chest and feel the sensations of the hips, possibly a little stiff. Gently come out of this and we'll work on opening out the hip joint. Have your left leg out in front of you. Draw your right knee in towards your chest and cradle it in your hands. Remain perfectly still. Gently drawing the knee in towards you. Focus on your pelvis. See if you can keep anteriorly tilting it or moving it forwards, rolling it forwards, coming more onto your sit bones. Try changing hand positions. Try gently moving the knee into different positions, but each time holding it for a moment to see if you can feel an easing out of the ligaments around the hips that are holding it tight. Again, wrap your arms around your leg and squeeze it in tight. This is often taught with a rocking motion, and that feels really nice, but it's not really achieving anything because it's just moving the opposite side of the pelvis about. And what we're trying to achieve is an opening out in the hip joint by releasing the ligaments. And this requires a little bit of time. Slowly release that leg away. Bring yourself into Baddha Konasana again with the soles of the feet together, knees wide. Come forward. Notice the difference between the two sides, the one that's been a bit released with any luck and the other one that may still have some stiffness in it. You may notice no difference whatsoever. Bring yourself back up into sitting. Take hold of the other leg. Cradle it in your arms and squeeze it in towards your chest. Really hold on to it tightly. Now see if you can roll your pelvis forward into an anterior tilt. You'll feel a squeeze or a pull or a sensation in your hip joint. Have a mess around. Try a different hand position. Try a different knee position. Hold it again. Perhaps drawing the knee back a little. Now wrap your hands around both of them together as if you're cradling a baby. Squeeze that knee into your chest. Focus on rolling the hip forward and hold it for a couple more breaths. Now gently release the leg, feet together, knees wide. Sit tall, inhale, exhale and come over those knees. Notice the difference in your hip joint, the sensations there, perhaps even in your low back. You may notice a beautiful release in the ligaments of the hips that allow you to come forward a little more easily.